Did you know that May is Mental Health Awareness Month? Such an important topic that does not get talked about enough. Listen to these numbers here. 1 in 5 adults experience some sort of mental illness. That's according to NAMI there. This morning, we have clinical psychologist Dr. Maria Espinola, as well as Christy Davis, both from UC Health, to talk more about this. Good morning to the both of you.
Good morning.
I'm so glad to have you both here to talk about it. It's so important. When you hear numbers like 1 in 5 adults, I mean, it's a lot of people that are affected. Talk about that a little bit.
Absolutely. It's actually more common than cancer, cardiovascular disease, diabetes, and also increased untreated mental illnesses, increase the risk for diabetes and cardiovascular disease on top of that.
Wow. Is it because so many people don't realize they may have something going on?
Yes. Yeah. So there's that, and there's also the stigma that is just devastating to communities.
Yeah, let's talk about that stigma there, because so many people, I mean, it seems like it could be a thought of it's a weak thing to go and get help.
Yeah, and that's what we're experiencing in several different parts of the community. This is happening nationwide, but right here in Cincinnati, obviously, we're concerned about our regional health. And so we're trying to, at UC Health, make sure that we get out in the community, talk to folks where they are, and start creating those touch points in your community, because unfortunately, nationwide, there are just not enough providers for mental health care. And so sometimes folks have to wait. So where do you go in the meantime? And who do you reach out to that you can trust? So one of the areas that we've been talking to lately are area churches, places where people feel safe and comfortable. Churches are starting to realize this is a serious issue for the congregation. And so some churches are even starting to put healthcare providers that folks in their congregation can start to talk to maybe once or twice a week. And that person then can start to refer them into stronger care if it's determined that they need more care.
That's super important. Really quickly, I think a lot of folks don't realize maybe it's something that they may have. How do you know? What are some of the signs when you should say, maybe when you're talking about depression as one of those issues, that maybe you're not just having a down week or down month, that maybe it's time to talk to someone?
Yes. Yeah, I think a good sign to look for is this impairing your ability to do what needs to get done. So are you having difficulty working effectively, taking care of your family, doing what needs to be done every day? So that's a good sign. Or sometimes people don't realize it, but everybody around them do. So like they start pointing that out, like what is going on with you? What are you different? What's going on? So when that goes on for more than a month, that's a good time to reach out. There's also a lot of things that you want to watch out for. Just, are you having difficulty with sleeping? Are you having issues with weight? So it's losing weight or gaining a lot of weight, isolating with people. So you know that it would be a good idea for you to reach out to your friends, but you just don't feel like it. It's just completely lack of motivation, just wanting to be alone.
And the thing is, things like this can happen out of the blue.
Yes.
You know, something can trigger an experience, something can kind of trigger those issues, right?
Absolutely.
That's good advice to kind of separate and figure out when it's time to talk to someone. You guys have a lot of outreach going on as well.
Yes, so we are really excited for Mental Health Awareness Month. Like I said, different communities have different experiences. Different communities have different traumas. And so at UC Health, we talk to the community a lot. And what we found is the Latino community really has a need for more information about well-being in general, managing stress, and mental health awareness, not just for adults, but for children too. So on May 22nd, mark your calendars, we are having an outreach event. It is a community conversation, part of our community conversation series on well-being in the Latino community. And we're really excited about, Dr. Espinola will be there.
Excellent.
This will be offered completely in Spanish.
Okay.
So all Spanish speakers are going to be able to come out and hear in the Spanish language ways that they can get the help that they need.
That's excellent. We're going to put the details about that, by the way, on our website at fox19now.com. Also, for folks who want to reach out and get more information, they can reach out to you guys too.
Absolutely. Oh, please do. Yes.
All right. We appreciate you guys both being here, shedding some light on an important topic. I think we should talk about this more often, honestly. We appreciate you guys here once again. The event, May 22nd. Again, all the details on our website at fox19now.com. Let's go over to